Welcome, everybody. Good morning, good afternoon, good evening, depending on your time zone. My name is Ohemo Godwin Pius, and it feels really good to welcome every one of you to the launch event of the Global Health Network Nigeria Country Center. We are super duper excited that this event is holding today, the 24th day of the month of January in the year 2024. So to start real quick, I'm just going to run through some quick information for your attention. My colleague Louis, you can help to change the screen. This webinar is being recorded and will be shared on the Global Health Network platform. Due to the number of participants on the call, your cameras and microphones are disabled. Please, we request that you use the chat box to introduce yourself or to let us know if you have any technical issue. You can also use the Q&A box to present your question, and members of the panelists will be happy to jump in as time goes on to give answers to your question. And then finally, we'll try as much as we can to get through as many questions as possible before the end of the call. Next slide, please. The list of panelists for today. I am chairing the launch event of the Global Health Network Nigeria Country Center. My name is Ohemo Godwin Pius, and I work as the graduate assistant at the Antimicrobial Resistance Knowledge Hub of the Global Health Network, and as well as the Hub and Media Coordinator of the Global Health Network Nigeria Country Center. I have on the call with me today Professor Akoni Akinyemi, the Deputy Vice-Chancellor of Deputy Vice-Chancellor Research, Innovation and Development, Obafemi Awolowo University, Ile-Ife, Nigeria. I also have Dr. Ola Ibigbami, the coordinator of the Nigerian Country Center of the Global Health Network, who happened to be a senior lecturer of the Department of Mental Health, College of Health Sciences, Obafemi Awolowo University, Ile-Ife, Nigeria. I have on the call as well my colleague, Goodness Ode, who works as the Partnership and Advocacy Coordinator of the Global Health Network, and Professor Babatope Kolawole, the Provost of the College of Health Sciences, Obafemi Awolowo University, Ile-Ife, Nigeria. I also have the honor and privilege to have on the call the Director of the Global Health Network, Professor Trudy Lang, and my very esteemed colleague, Christine Kirima, the African Regional Coordinator of the Global Health Network. So these are the list of panelists that I have with us today, and they will be speaking as time goes on. A quick look at the agenda for today. We are going to have a welcome address. The Deputy Vice-Chancellor Research, Innovation and Development will be speaking as we continue. We'll be introducing the Global Health Network Nigeria Country Center to you. We'll also be introducing the Global Health Network in general to you as well. We are going to have a keynote presentation from Christine Kirima on the opportunities that are available for early career researchers in Nigeria and beyond 2024 and 2025. We'll be unveiling mentors, the mentors for the Global Health Network Nigeria Country Center. We'll take goodwill messages, and then we'll take the vote of thanks. Joining us today, as you can see, the stats on your screen for persons who are already started for this event, and we hope that we'll have a large number of participants on the call from different countries of the world. A couple of links that you can use for resources in case you need any. The official handle or the official link of the Global Health Network Nigeria Country Center is what you have there. And you can also check the website address of the Obafemi Awolowo University for any information that you might need. So having said that, it is an honor for me to welcome on stage my colleague, Goodness Ode, the Partnership and Advocacy Coordinator of the Global Health Network Nigeria Country Center, to give the welcome address. Welcome, everybody. Goodness, if you are ready, we are ready. Over to you.
Thank you so much for that very warm welcome, which I think I would be extending it further. We are excited to have everyone. Good morning, good afternoon, and good evening from wherever in the world you are joining us. But specifically to our dear Nigerians, we are more than excited to finally see the launch of the Global Health Network Nigerian Country Center. This vision, I would say, for the Nigerian Country Center began from a place of a not so great experience myself Dr. Ola and Pius had when we attended the Global Health Network Conference in Cape Town. And from losing our luggage, we moved just beyond that unfortunate incident to saying, what can we do for our country, extending this huge and amazing resource and platform to Nigerian community. And this doesn't mean that the Nigerian community does not have ongoing research, capacity building trainings, skill developments. But then we felt that the Global Health Network as a platform would be most beneficial to the wider academic audience and beyond academic audience, policy and system strengthening for our nation. And it is in light of this that we are finally here for the launch of the Global Health Network Nigerian Country Center. The Global Health Network operates in three manifold, which you get to learn more, and it embeds research where evidence is lacking, specifically health research, and the aim is to drive equity in participation and benefit for health research and to build capable research teams in low resource settings. This objective resonates deeply with the challenges and opportunities in Nigerian healthcare landscape, and we are proud to establish the Nigerian chapter as a hub dedicated to realizing this vision. In alignment with the Global Health Network overarching goals, our Nigerian country center will play a pivotal role in strengthening research capacity development within the country. This center will also serve as a catalyst for implementing strategic vision, promoting the Global Health Network resources and training programs, and definitely fostering partnership to advance global health topics and health research. And in view of this, we hope that every one of us who have been able to join this call today would join us as a member of the country center to see to the attainment of this vision. As we embark on this journey, I want to implore us to embrace the spirit of collaboration, innovation, and inclusivity, which is something that Nigeria as a nation is known for wherever in the world. Together, we can make significant strides towards achieving equity in health research, improving research methods, building robust careers, and sharing knowledge for the good of global health and our dear nation, Nigeria. Once again, thank you. We deeply appreciate our hub host organization in Nigeria, being the Obafemi Awolowo University, who are present here on the call. We appreciate the support we've gotten so far from the global team of the Global Health Network and the regional team from the African Center. And I hope that this will be one of many more exciting work that we get to do on this journey. Once again, thank you and welcome.
Thank you very much. Goodness, that was awesome. Thank you so very much. Ladies and gentlemen, if you are just joining us, this is the launch event of the Global Health Network Nigeria Country Center, holding today, the 24th of January in the year 2024. We are super duper excited that you could make it. Real quick, given the fact that we have some principal officers of the Obafemi Awolowo University Ile-Ife on the call with us, I have the honor and pleasure to invite the Deputy Vice-Chancellor, Research, Innovation and Development, Professor Akani Akinyemi, for his welcome address as well. Professor, over to you, sir.
Thank you so much. Let me, on behalf of the Vice-Chancellor, Professor Adebayo Bamire, let me welcome every one of us to this very special event of the launch of the Nigeria Center of the Global Health Network. I sincerely want to appreciate all those who have worked behind the scene to make this possible. Particularly, we appreciate this collaboration with Oxford University and the Global Health Network. The Obafemi Awolowo University is warmly in support of this, and we are looking forward to this type of collaboration and many more. But let me assure you that as a university, the Vice-Chancellor has given his support, his permission, so whatever system support that this will need to make for efficient functioning, that the university is ready to provide that. My special thanks to Professor Truth Lange for this, the head of the Global Health Network, for this, for our visionary leadership in this process. Dr. Ibami has always informed me about all the roles she's been playing to make this a success. And also even during the process of signing the MOU, I saw all the back and forth that we have to do. So sincerely, thank you for your visionary leadership. And also to thank our own Dr. Ibibami for making this possible. It takes the art of good to bring this type of initiative home. So we want to sincerely appreciate you. And let me just assure us that just to show you the support of the university, many of us are here, but again, we have the Executive Director, Central Office of Research, in person of Professor Moreni Keukwan. Unfortunately, because I'm in another meeting, I won't be able to stay for so long on this. But Professor Okwang is here to represent the Vice-Chancellor on whatever issues that we need to take forward. So again, to thank all for joining, and again to reassure us that the university, Obafemi Awolowo University, is fully in support of this, and whatever we need to do to make this happen, that we continue to support. Again, to appreciate our colleague from Oxford University, and also the Global Network. Thank you so much. And I want to wish us a happy launch of the networks. Thanks so much.
Thank you very much, Professor Akani. We are very, 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 very glad that you could make it. This is a very important event, and we are happy that out of your busy schedule, you made our time to join us. Thank you so, so very much. Once again, for those who are just joining us, this is the launch event of the Global Health Network Nigeria Country Center. We are super duper excited that you could join us. If you haven't introduced yourself to us yet, we request that you use the chat box to let us know your name and where you are joining us from. Without wasting any bit of our time, it is an honor for me to bring to the fore the director of the Global Health Network, my boss, our boss, the visionary, and the person who brought into existence the Global Health Network that actually has extended down to Nigeria as a country center. Ladies and gentlemen, please join me in welcoming Professor Trudy Lang as she walks us through what the Global Health Network is all about. Trudy, welcome.
Thank you so much. And I have to extend such a huge thanks to you, first of all, for doing all the hard work to put in this, bringing us this far. Just a joy to my heart to see Goodness. And our journey from her losing her luggage and giving her presentation so brilliantly and bravely in Cape Town. My very dear old friend, because we're both very young, Professor Ukpong, I'm so happy to be here with you, and for our academic colleagues and the leadership you're showing right from the top of the university. Thank you so much for hosting this and making this all happen. The first thing to say is the Global Health Network is a very flat structure, so there's no one in charge. It's everybody's, and you are all in charge. And I feel very privileged and honoured to speak to you all, and extending a welcome of joining this very happy family. And I'm also super duper excited to coin Pius's wonderful phrase. And what is absolutely just makes this all seem so correct is I'm actually talking to you from Uganda, from Rwanda, and we're at the Global Health Equity University. So we're talking all about equity here in Rwanda, and hoping to launch the Global Health Network Rwanda very soon. And so talking to you from Rwanda, launching the Global Health Network Nigeria is just perfect. Just a small little piece of introduction about what we're trying to do. I won't talk for very long at all, as I don't want to take up any of your time, because you all need to talk together and decide how we're going to move this forward. But just to say that the Global Health Network was born in Africa probably about 15 years ago, and the whole purpose is to try and create equity in access to who can undertake research, who can lead research, and who benefits from it. And the whole idea is to create these connections between everybody. So you guys in Nigeria working more closely together, connecting up with your colleagues here in Rwanda, and also across the globe and across Africa. And this is so required because we're at a really, really exciting time in health research where methods and opportunities are changing really fast. And it mustn't be that those advantages are all used up in the global north and the global south is left behind. And so how can we all work together to make sure you have access to those abilities to do research and move forward as if you were working anywhere in the world? And that's what this is all about, to get research methods to you, training opportunities, ability to work together and form collaborations. And that can all be found within this Global Health Network community, because it can link you to research organizations and to each other and enable people to form new teams, access funding, learn how to run studies. And this is what this is all around. And hopefully bringing this into Nigeria, you can set up particular workforces and groups and activities just to drive some of these ideas and take this forward within your own setting of healthcare. And also maybe you're in a lab or working in social science, but you can come together and access these resources and hopefully really build your own research careers. And I'm waiting to see the day when we have goodness as a professor and winning a 5 million research grant from Wellcome, and we can show that in all of her brilliance, and many of you, I hope this reaches and leads to these sorts of successes. So it works because this is a facility that connects up research organizations with the research community. It's all about mobilizing knowledge and know-how, and this happens in person, in situ, as well as online. And this is the opportunity in Nigeria for you all to take part and undertake some of these activities that can drive this forward. So potentially running research clubs in hospitals or community health centers, working in laboratories, getting together and talking about research, what the barriers are, what you're finding difficult, and then working together to maybe think about what training you need, or coming together and planning studies. Sometimes they need funding, sometimes they don't, but you know, together there's so much power in working out your research focus and taking that forward. All this is based on the premise that we need a whole ecosystem of different types of studies, and we need a set of skills to be able to deliver those. This is the basic sort of theoretical framework that we base everything on through the Global Health Network, and it's all about delivering the skills and resources that you can take up to grow your research careers and strengthen the research system in Nigeria. So research system strengthening is absolutely the goal here, and doing that by learning by doing with individuals and teams to teach them to have the skills to tackle whatever research priority you want to do and grow careers around that. The other side of it is that we have direct partnerships with so many global organizations, and you can access their knowledge and information, and hopefully opportunities to build relationships and partnerships with those. And this globally connecting up across the world will help Nigeria build its reputation as a global leading research country, and the teams within it to build those skills and qualifications and abilities to do it. So I'm going to stop there. It's really over to you guys to take this whichever direction you want to, and I'm looking forward to hopefully maybe coming over sometime soon to see some old friends and you. Congratulations for today, and I'm so excited that we have a new member of the Global Health Network global family. So back to you all, and thank you very much.
Thank you very much, Professor Trudy Lang. We are super duper excited again to have you on the call. We look forward to welcoming you to Nigeria whenever the opportunity arises for you to visit this country again, or at least for the first time, so to say. Ladies and gentlemen, if you are just joining us, this is the launch event of the Global Health Network Nigeria Country Center. We've made a lot of progress, but we are happy that you are here with us today. So you can use the chat box to introduce yourself, and let's get to know you, and let's get to know perhaps the research that you are into at the moment. Without wasting any bit of our time, it is an honor for me to welcome on board the Director of the Nigerian Country Center of the Global Health Network, Dr. Olanrewaju Ibigbami, for his presentation, walkthrough center. Dr. Ola, over to you.
Well, good afternoon, everybody. I guess it's a good time for all of us to be super duper excited. So I will jump on that phrase and say, indeed, I am also super duper excited to be here today. So my talk will be on the Nigerian Center of the Global Health Network. And I will talk about the aim of the Global Health Network, the Nigerian Center, the activities that we hope will embark upon, and talk about briefly the organization of the Global Health Network in Nigeria with regards to the relationship between the Global Health Network Center in Nigeria and also other of our centers in different parts of the world. Then I will say a little bit about the funding and the outlines of activities for this year, and also acknowledge some people. Next slide, please. So the aim of the Global Health Network Country Center, according to the Global Health Network document, is to work with the Global Health Network to strengthen the countries and regions' health research environment. So we know that something is going on in virtually every country, but we want to see how do we build up the capacity further and be able to achieve much more by working with the resources that the Global Health Network has to offer. So the Country Center will be an active leader towards scaling up access to the Global Health Network resources to serve more research communities in Nigeria and other nations in the Global South. So through this partnership, country-level hubs are being set up, and Nigeria is the new baby in the block now. And so we intend to provide access to the e-learning resources of the Global Health Network through the Nigerian Center to provide research support for early career researchers in Nigeria, and also provide opportunity for mentoring for those who need such, and also skill-based training opportunities, career development, and also the opportunities for supporting funded research in different parts of the country. So the OAU is not, this is not an OAU thing. It's not just Obafemi Awolowo University. OAU is the Nigerian center that is hosting the TGHN in Nigeria. So we are inviting all early career researchers and also those who want to be mentors who are interested in health research to come on board the Global Health Network Country Center, which is based in OAU. Next slide, please. So the activities of the TGHN will include to identify research priorities. And we know that there may be gaps that we need to fill. And most of what we're going to be doing, everything we're going to be doing is going to be data-driven. We want to be able to provide the evidence for whatever we're going to do in TGHN. Then building of capable research teams, enhancing the skills and promoting the training of young researchers is also another activity that we intend to embark upon. Then we intend to go towards strengthening research capacity and knowledge mobilization without the institutional barriers and associated perceptions. And also we intend to provide recognition for high quality research and work in healthcare for the country's researchers, teams and institutes on the neutral, trusted, and internationally recognized platform of the Global Health Network. Indeed, there's a saying that we choose to stand on the shoulder of giants so that we can see further. We intend to leverage on all the opportunities that are available on the Global Health Network to strengthen what early career researchers who are interested in health are going to be doing subsequently. Next slide, please. So we also want to ensure connectivity with wider partner organizations and networks in a particular focus area of multiple interests with the Global Health Network as an agency for convening networks and partnerships. We know that there's a lot that the Global Health Network is doing, and we want to bring that home and make sure that a lot of people have access to that here and provide opportunities for stronger collaborations and participation in multi-center funded research programs. At the end of the day, we want to be able to say how many collaborations are we having with researchers in Oxford University and also other universities in Nigeria based on the collaboration that the Global Health Network provides. We want to also be able to secure access to all the e-learning models and resources afforded through the platform for wider educational benefit. We're going to share with us eventually the website of the Nigeria, the landing page for the Nigerian Center of Global Health Network. If you go onto that landing page, you will see a lot of resources that we've put together that we know will be useful for early career researchers in Nigeria. You can go and do e-learning on ethics, on development, good clinical practice, on research, data management, data analysis, so many other things that any early career researcher would want. We also have access to personal development plans, so that if you want to develop a plan for yourself, there are also resources there for you to be able to have a personal development plan for yourself. Next slide, please. So we're also looking at career development activities to support leadership potential and ensure the development of high quality and competitive research teams. And also eventually would intend to provide increased visibility with key international actors, include the WHO, because we know that the Global Health Network is a WHO or collaborative center, and all other agencies that the Global Health Network partners with towards getting funding and other support for researchers. These organizations use the Global Health Network to source and identify existing expertise, as well as potential groups and sites to collaborate with. Next slide, please. We intend to use this platform to seek and collaborate on further joint research grant proposals, building on local and regional partnerships, and also to design and implement programs for skills sharing and research capacity building, some of which are seminars, workshops, webinars, research clubs, data clinics, mentorship, and training activities. The Global Health Network has probably one of the best ICT support for researchers in the world currently. And we have access to that now. And we did want to use that for capacity building opportunities, for seminars, for workshops, even for conferences that we will be able to host and be able to talk about critical things that will move health research forward in Nigeria. Next slide, please. And so with regards to the organization, currently we have a central support from the Global Health Network. There's a training team that is available to continue to train and build our capacity through seminars, workshops, and also the online resources. Then there's also a digital team that we enjoyed a lot of support from the digital team through Louis. We had several meetings to prepare this meeting, and that resource is going to be subsequently available to the Global Health Network Nigeria Center for use. Then also communication team and research capacity and knowledge coordinators who are also part of the central support that we have. Then we also have the coordinators for the Nigerian Center. I am the lead coordinator. Then we also have Goodness Ode and Pius Ohemu who are also co-coordinators with me. Then we have our mentors that will unveil very soon. And we intend to set up a steering committee after this launch. And that steering committee is going to consist of people who have had experiences, opportunities, access to opportunities of the Global Health Network, and have benefited in one way or the other, and are interested in being a part of this laudable activity that we want to do. And so we would be talking about knowledge exchange committees, capacity building and professional development committees, research committees, grantmanship and research funding committees, conferences and retreats, because we want more people to be on board. It's not something that one person can do. We want as many people as are interested to work within these steering committees and ensure that we all get the outputs that are going to move research forward, health research forward in Nigeria and then also beyond. Next slide, please. So the funding model currently is going to be task or project dependent. So that if we have a task or a project that we want to do, then we'll look for funds for such a task and get it implemented. And so to secure sustainability, grant opportunities will be identified and applications will be submitted to support the partnership and locally relevant research programs. And so the Global Health Network Central team will leverage and connect the country center regionally and internationally to apply independently or in collaboration with other centers to grant opportunities. And of course, there will be funding awards which will flow directly to lead applicants through the country centers, outlining the operational support and research grant management system that is in situ within the host institution. So that's one of the strengths of having a Nigerian center, OAU center, because we now have a place. If you want to get a grant, you have an institution that we've gone through a lot of process, signing the MOU and ensuring that we have all it takes to be able to manage funds that come in from outside for research purposes. So all we've been doing has been through volunteering and also personal funding to ensure that this goes up. And eventually, by the time we start off, we're going to be able to have access to opportunities to access funds for specific tasks or projects that we intend to achieve. Next slide, please. So we're proposing a timeline of activities for the Nigerian Center this year, and we're currently doing the January formal launch. And in February, the steering committees will be constituted and would assign the different tasks to the committees. And of course, between March and August, we will then embark upon the research capacity gap and needs assessment. So we're going to look at what exactly are the research needs of early career researchers in health in Nigeria. And it is going to be empirical. We're going to eventually even publish our findings to lay a foundation for what we will be doing in the next 2 years subsequently. And so between September to December, we intend to embark upon 2 sets of activities, and that will be source for funds, preparing proposals and submitting proposals. Then also we intend to start having data science gaps analysis, training and community of practice formation. We're going to be using the e-learning and training resources that are on the website, on the Nigerian landing page. And also we will have data science clinics where we will go through the nitty-gritty and the details of the basics of data science as it's related to health, so that many more people can come on board. Some of these activities eventually might overlap as we go on through the year, but this is just a template that we are proposing and which we know we will be able to work with. Next slide, please. And so I would like to just acknowledge Professor TGHN Lang, who gave us, she charged us after we all lost our luggage and said something could come out of it and that she was waiting to hear from us. And so we say that here we are, we've followed up on the lead, and of course, we've been able to put this forward, and we know that it's going to work out well. And we're grateful to the Deputy Vice-Chancellor Research, Innovation and Development of OAU, Professor Akoni Akiyemi, Professor Babatope Kolawole, the Provost of the College of Health Sciences, the Executive Director of the Central Office of Research, Professor Moreni Kaifolayo, Professor Babajide Odu, Professor Oniro Oluwaroti. All these persons who are involved in reviewing the MOU before it finally was drafted here. And also we're grateful to Frank Kagaro, who started with us. He helped us in charting a course forward over a year ago with regards to what we're doing now. And of course, the African Regional Coordinator, Christian Karima, the IT support team, and of course, my friends and co-coordinators, Powers and Goodness. Next slide, please. And of course, I've used materials from the website, from OAU, from Oxford University, the MOU that was signed, and of course, notes from the meetings held between the regional and national coordinators to prepare this presentation. Next slide, please. So I want to say thank you, and this just shows where all this started from. Right there, when we were with Professor TGHN Lang, this was the picture we took after she told us to go and set up the Nigerian Country Center. And there is Goodness, Powers, and I, when we finished having a chat with her. So thank you very much. I'm so happy, super duper excited to have you all with us on the call. Look forward to much more productive interactions based on the Global Health Network efforts in Nigeria. Thank you very much. Over to you, Pius.
Thank you very much, Dr. Ola. Thank you so very much. I am super duper excited to hear and listen to all of those comments that you have made. They are very, very wonderful. one thing you didn't tell my audience is that we finally got our luggage. You know, the company, the travel company, the air company that we used later, you know, brought our luggage to us at the end of the Global Health Network conference in Cape Town. It was on a Friday. We left
at the end of the conference.
At the end of the conference. So it's really funny. But, you know, we are happy because the missing luggage actually led to this conversation. And today, the Global Health Network Nigeria Country Center is, you know, is begotten. Okay, ladies and gentlemen, you're welcome once again. For those who are just joining us, this is the launch event of the Global Health Network Nigeria Country Center. We've made a lot of significant progress in our discussion, and without wasting any bit of our time, we are going to jump in straight to the keynote presentation that will be made by the African Regional Coordinator of the Global Health Network, a very sound and intelligent colleague of mine, Christine Kirima. If you're on the call, I'm ready, and we are ready to hear from you. Over to you, Christine.
Hi, Pius. Thank you so much for that lovely introduction. And I believe it's morning where most of you are, or close to afternoon. So a very good morning and a very wonderful afternoon to all of you. I just want to say a huge thank you to all of you for attending this launch. It's been, as Dr. Ola said, it's been a year in the making. And so it's so wonderful to have gotten to this point of being able to launch. My name is Christine Kirima. I am the African Region Coordinator at the Global Health Network. I support knowledge mobilization and capacity strengthening efforts all across the African region. And I'm just so excited, again, super duper excited, as Pius has now taught us, to have been able to be a part of this and to see it to its fruition and to see Nigeria added to our list of countries where we can continually support and strengthen research capacity. So my presentation was going to be really short anyway, but I think it's been made even shorter because we have an incredible team who've already covered it. We've heard from Trudy, who has provided us an introduction on what the Global Health Network is, and then importantly, the presentation by Dr. Ola, which has gone into the nitty-gritties of what it is to be the Nigeria Country Center, what the benefits are, and some of the ways that we can continue to collaborate and enhance research capacity in Nigeria. And so I won't belabor the points at all. I think they were perfectly delivered. And obviously, the slides are available to be shared to all of you. And so if you'd like to go to further details, we can do that. But this is what I wanted us to go over, is what it means to be a country center and some of the opportunities that are now readily available to yourselves as members of the Nigeria Country Center. All right, so as Trudy said, the Global Health Network is really a child of Africa. It was born here, and it was really out of a need of wanting to see equity in where research happens, who leads it, and then importantly, who benefits from it. And that's why over time and over the years, we've embraced the franchise model of giving over the Global Health Network to people and to researchers all across, not just in Africa, but also in Latin America and Asia, so that they can do with it what they please. There's a lot of work that has gone into building this network. We are a network of networks. We are composed of a lot of communities of practice in different areas of diseases and different thematic areas as well. And so whatever your interest is, there's probably a community already available. We have over 60 communities of practice, and these are really composed of people who are passionate about changing a particular situation, whether it be in the area of maternity and child health, whether it be in the area of neglected tropical diseases or non-communicable diseases. So these are researchers as well as research institutions that come together to share knowledge, to share expertise, and to just break the barriers and to take out the whole situation of working in silos. There's so much power in coming together, and there's so much power in sharing of knowledge and lessons learned, as well as challenges, to be able to come up with solutions. And so that's why it's really critical for us to continually encourage as many people as possible to take over the Global Health Network and make use of it. And that's why we are eternally grateful, firstly, to Obafemi Awolowo University for seeing the vision and agreeing to be a part of us, and even going a step further to say that they will host this country center. And so we're just super excited to see where this takes us. Dr. Ola has covered this beautifully on why it's important and why to become a TGHN country center. And first and most importantly, is because it gives you autonomy to be able to decide what your research priorities are, where the gaps are and what your needs are, and be able to come together as a community to see how you can chart a path forward to address those. And then importantly, it not only gives you increased visibility with key international actors, but even within your local settings, to come together and speak with one voice to address problems within your communities yourselves. And so we, as the central body of the Global Health Network, are obviously always going to be available to provide you with any resource and any support that will be necessary to carry this out. So again, this was beautifully covered by Dr. Ola. We work within a federated partnership where we ensure that yourselves as the Nigeria Country Center will be working autonomously to address your own local needs and your own local research priorities, and go ahead to even apply for funding independently and be able to carry out those processes. And in the next slide, you'll have a look here and you can see that you're joining an already established, really enthusiastic group of Africans all across the continent with already established country centers, including Ghana, Sudan, Malawi, Rwanda, which we're working on today. And then finally, we're adding Nigeria to the list of amazing researchers and research institutions that are going to be making a difference and improving the lives of our communities and our people. We'll also be working, and you'll see a lot of the work that we do within the Global Health Network is also working with important regional centers and partners like AMREF and Africa CDC. And so we'll be making use of our connections and the different projects that we're working in to also showcase the amazing research and work that will be coming out of Nigeria. So I tried to think about the best way to present the hundreds of opportunities that are already available to you now as members of TGHN Nigeria. And I tried to summarize this in a single slide. It wasn't particularly easy. But of course, I know we will have more opportune moments to delve even deeper into every single one of these components to understand how it could not only benefit yourselves as individuals in terms of growing and developing your own careers, skills, but also importantly, how you can take advantage of the resources and the trainings provided to you by the Global Health Network to build capable research teams. Our ethos is really ensuring that we are moving the knowledge from where it is to where it needs to be. And there's this concept that we've been talking about recently about flipping the pyramid and just recognizing that research doesn't have to remain at the very top of the pyramid where we have clinical trials taking place, but really recognizing that the power is in the base. The power is within our community healthcare workers, our nurses, our midwives, our lab technicians, our physiotherapists, and so on. And so a piece of work was done a few years ago between WHO and the Global Health Network so we sat down and thought about what would be essential research skills, which if provided to any one particular person or a team, they will be able to carry out research anywhere they would be in the world and carry out high quality research. And we've put together a curriculum, which is what our freely available e-learning courses are based on, that include essential research skills, essential topics in this research skills. And so this is obviously available to anyone, wherever you are in the world. You can take this up. They're all certified courses that you can take advantage of to grow yourselves and your teams as well. Trudy also spoke about this next component on research toolkits. Like we said, we are a network of networks. We are composed of tons of communities of practice, and these are made up of professionals and other people who are passionate in various areas and different thematics and diseases all across the globe. So they come together to share protocols that have worked for themselves in their own settings. They also share guidelines and best practices. And these are hosted within the Global Health Network and are freely available to yourselves. So again, we will have a dedicated session to show you how you can access this. And of course, my colleague, Godwin Pius, has done an incredible job of summarizing some of this already on the Global Health Network Nigeria Country Center website. So you'll be able to have free access to that. And we will show you how to even go further to find the resources that you need. We've also talked about this, about webinars and workshops. And these are usually carried out either online or in person as well. And this just further allows us to be able to move the knowledge from where it is to where it needs to be. And then finally, just we've also perfected, I would like to say, our way of supported learning sessions and ensuring that, again, we're continuing to move knowledge. So the graphic that you see to your left-hand side is a culmination of the incredible work that was done with WHO and TDR to put together essential research skills. And what we discovered is that in any given team, if we have someone who is conversant with putting together a research question, if we have another person that is skilled in community engagement skills or in data science, and importantly in uptake and impact, you would be in a fantastic position to be able to carry out high quality research that can be shared all across the world. And so again, I tried to summarize this in a single slide. It wasn't easy. We will have further discussions about this. We've seen the incredible work plan that Dr. Ola and the team have put together. And so we're incredibly excited to take you on this journey and to see how we can better support you in everything that you do. And again, I just want to say a big thank you to Pius, to Dr. Ola, and to Goodness for all the incredible work that has gone on behind the scenes. This has been almost a little over a year in the making. So you can truly see their passion culminate into this great day. So thank you, everyone, and I look forward to interacting with you all further. Thank you.
Thank you very much, Christine. That was awesome. Thank you so very much for the walkthrough, and thank you for sharing with our audience what it means to be a Global Health Network Country Center. Ladies and gentlemen, if you are just joining us, this is the launch event of the Global Health Network Nigeria Country Center, holding today, 24th January 2024. We are happy that this event, is going on well, and a lot has been said. A lot of incredible individuals, they have made comments, and we have to move on straight to the next item that we have on our agenda, and that is the unveiling of mentors. The ideal of mentors is because, as Dr. Ola said in his presentation, according to, I think, Isaac Newton, he said, in order for you to see further in life, you should stand on the shoulder of giants. And we need the professional expertise, the professional guidance of carefully selected individuals who are doing excellently well in the field of global health research. We just want to stand on their shoulders and see how we can learn from them and how they can also bless us from their wealth of knowledge to help improve and further the cause of the Global Health Network Nigeria Country Center. So, ladies and gentlemen, I am going to very briefly introduce to you and to everyone on the call, one after the other, the individuals that we have selected to serve as the mentors of the Global Health Network Nigeria Country Center. So, Louis, if you don't mind, you can show me the first slide and let me introduce the individual to members of the audience. The first mentor that we have on our list today is Professor Morenike Oluwatoyin-Folayan. She is the Professor of Pediatric Dentistry at the College of Health Sciences, Obafemi Awolowo University in Ile-Ife, Nigeria. Professor Morenike is an accomplished academic at Obafemi Awolowo University, OAU, in Nigeria. She currently serves as the Executive Director of the Central Office of Research. She's recognized as a Fellow of the Nigeria Academy of Science, and she has held key roles, including Deputy Director of the College of Health Sciences Partnership and Research Advancement Unit. She also oversees the Research and Innovation Support Unit at OAU and has actively contributed to public health advocacy as the coordinator of NHV-MAS. Ladies and gentlemen, please join me in recognizing Professor Morenike Oluwatoyin as a mentor of the Global Health Network Nigeria Country Center. Professor Morenike, please.
Thank you. Thank you very much. It's indeed a pleasure to be here. And once again, congratulating you for getting this far. I am very pleased as myself, a fellow of the GHTN, a locked-up friend of Judy. It's been a long walk getting here. As the Executive Director of the Central Office of Research for the institution, hosting this big project, where we also are very particular about early career researchers' development. And then for me, looking forward to holding hands of members of GHTN through the work in terms of the aims and objectives that has been highlighted by your team. So congratulations to GHTN Nigeria, congratulations to GHTN Global, and looking forward to the outstanding results that will come out from this body. Thank you. Over.
Thank you very much, Prof. Thank you so very much. For those who do not know, Professor Morenike Folanyo is a world-class ethicist. I must confess, we are very blessed to have her in the postgraduate diploma course of the Global Health Network, University of Oxford, I think last year, and she carefully converted all of our students to becoming ethicists, of which I am one of them. So I am super blessed, and we are all blessed to have Professor Morenike as a mentor of the Global Health Network Nigeria Country Center. So Louis, next person on the role as a mentor of the Global Health Network is Dr. Anto Odu-Ndep. I'm sorry if I didn't pronounce it very well. She's a senior lecturer and the head of department of the Department of Public Health, University of Calabar. Dr. Ndep has over 20 years of public health practice experience, including management level position. She has held training for staff and volunteers of national and international organizations, and she has held consultancy position with FHI 360, Safe Haven Development Initiative, Mediatrix Development Foundation, and Steady Flow Missions and Home Care, among others. She is a very wonderful person, and I am honored. I'm honored to present Dr. Anto Odu-Ndep to us as a mentor of the Global Health Network Nigeria Country Center. Dr. Anto.
Thank you very much for that introduction, and congratulations once again for the Nigeria Center. I am very pleased to be part of this network, and I am. It's a proud mama moment for me whenever I see goodness and the work that she's doing. So right now I am really pleased at what's going on, and I am very willing to work with all of you to foster the goals and the vision of the Nigerian Center of the.
All right. Thank you very much. Glad to have you on the call with us. Okay, Louis, can we move on to the next slide, please? The next person that I'm going to introduce to us today, I was smiling when Professor Trudy Lang said she looks forward to when goodness is going to become a professor. I am also very happy because I am not only going to become a professor somewhere in the nearest future, but I already have somebody who is a mentor on the list, and he also shared the same name with me. So, ladies and gentlemen, it is an honor for me to introduce Professor Godwin N. Aja, a professor of public health at Babcock University, Nigeria, and Adventist International Institute of Advanced Studies. Professor Godwin is a professor of public health with a demonstrated history of working in the higher education industry. He is skilled in public promotion training, health program assessment, planning, implementation, and evaluation, and health asset mapping. An astute health promotion professional with experience in building community partnership and engagement in health promotion research and social care, including women's and adolescent health and advocacy for health system strengthening. Ladies and gentlemen, please join me in recognizing my namesake, Professor Godwin N. Aja, as a mentor of the Global Health Network Nigeria Country Center. Professor Godwin, over to you.
Thank you so much, my namesake. It's such a great privilege to be part of this epoch-making event. I wish to congratulate you for coming this far. I've been part of the development, and I know the effort you all have put into this. And I wish to assure you that I will provide my unalloyed support to ensure that we all succeed in achieving the goal of the Global Health Network. Thank you so much, the OAU administration, for accepting to host this great initiative. Thank you so much, the Central Support Team, the coordinators, my namesake, and Dr. Ibibani, and of course, Goodness, who has really played an important role in this whole enterprise. Thank you so much, and congratulations, fellow mentors. We are all in it together, and by God's grace, we will do our best. Thank you very much.
Thank you very much, Professor Godwin. Thank you so much for joining us. We are very, very glad, to have you on the call as a mentor of the Global Health Network Nigeria Country Center. Ladies and gentlemen, the next person that I have on the call that I'm going to introduce to us as a mentor of the network is Professor Adewale Adisa. Louis, please, can you help me with the screen? Yes, Professor Adewale Adisa is a professor of surgery at the College of Health Sciences, Obafemi Awolowo University in Ile-Ife, Nigeria. Professor Adewale Adisa is a professor of surgery at the Department of Surgery, Obafemi Awolowo University. He does research in general surgery, including the expansion of minimal access surgery in Africa. His current projects are laparoscopy surgery and global surgery. Ladies and gentlemen, please join me in recognizing Professor Adewale Adisa. He is currently on a trip in the United States and unavoidably absent, currently unable to join us on the call. However, we have done our best to introduce him as a mentor of the Global Health Network. The next person that I have on the screen that I really want to introduce to us, I took note of what everybody said on this call. And when the Deputy Vice-Chancellor of the Obafemi Awolowo University was speaking, he said that he is so proud of Dr. Ola Ibigbami for what he has done and for bringing the Global Health Network Nigeria Country Center down to the Obafemi Awolowo University. I felt somehow, but I just want to say I'm fine because I also have somebody from my own alma mater, the only unique university in the universe, Dr. Kome Otukunefo, who happened to be a lecturer and a researcher at the University of Port Harcourt. I'm very peculiar about her presence on the mentors list because her father, late Professor Otukunefo, actually inspired my interest in antimicrobial resistance. And so, ladies and gentlemen, Professor Dr. Otukunefo is an academic researcher from the University of Port Harcourt. She has contributed immensely to several research topics, including drug resistance and multi-drug resistance. She has an index of 5, co-authored 18 publications, receiving 113 citations, and her previous affiliation is with the University of Nottingham. Ladies and gentlemen, please join me in recognizing the daughter of my own mentor, lead Professor Otukunefo, Dr. Kome Otukunefo, all the way from the University of Port Harcourt. Dr. Kome, over to you.
Hello, everybody. Thank you. I am honored and elated to be part of this initiative, and I know that together we'll change the face of science, particularly antimicrobial resistance, not just in Nigeria, but also globally. Together, we're going to do great things. Thank you.
Thank you so very much, ma'am. Thank you so much. Louis, last but not the least, I'm going to also introduce Dr. Tochi Joy Okwo. She happens to be the antimicrobial resistance and infection prevention and control coordinator, as well as the chair of the Nigeria AMRCC of the Nigeria Center for Disease and Control. Dr. Tochi Okwo is the National AMR and Infection Prevention and Control Coordinator at the Nigeria Center for Disease and Control, and she does amazing research in AMR, IPC, and health security. I can't tell if she's on the call at the moment, but if not, I believe we have unveiled all of the amazing individuals who generously accepted to serve as the mentors of the Global Health Network Nigeria Country Center. I think she's unavoidably absent. So, ladies and gentlemen, very quickly, I have run through the various lists of individuals that we have as the mentors of the Global Health Network. The next thing that we have on our agenda for today is the receipt of goodwill messages. And I'm going to hand that over to my colleague, Goodness Odi, the Partnership and Advocacy Coordinator of the Global Health Network Nigeria Country Center, for us to lead us in that process. Goodness, over to you.
Thank you so much, Godwin, for moderating this launch event excellently so far. And I am glad that we have been able to set the stage, and officially we can say we have a country center. I want to appreciate everyone who has taken their time to join this meeting. And I also feel like the various speakers and members of the panel have robustly spoken on the necessary appreciation for everyone who contributed to this process. So I wouldn't want to take our time to go over that again. But thank you to everyone who joined the call, to everyone who has listened and definitely has reflected or would be reflecting on how you can contribute to this vision and how we can collectively build a stronger research database for Nigeria, not just a database, but ensuring that the evidence generation translates into practices that strengthens our health system and academic excellence in Nigeria as a country. So we're excited to do this with you. And as rightly said, you can always get more information from our website. In addition, I would say that we all are aware of this very popular quote about if you want to go fast, you should go alone. But if you want to go fast, you should go with others, work as a group. And we want to go far, and we have seen this as a long-term vision that would bet so much more than we are even envisioning at present. This is why we want to again implore and encourage everyone to please stay connected. And if you know other people within the Nigerian research community who would benefit from the immense resource and the plans we have in place, feel free to reach us. Our details are on the Global Health Network website. When you check the country hubs, you would find our details there, as well as the OAU research website. So it would be helpful if we get that feedback from you and continuous engagement and collaboration. Once again, I think the thank you would not be enough, but again, thank you for joining us to bet this vision. And there's so much more to be done, which is the most exciting part of everything we are doing today. Have a wonderful day.
Thank you very much. Goodness. Thank you so much. Dr. Ola. Okay. The Provost of the College of Health Sciences. I'm sorry if I didn't get it correctly. Could you please just raise your hand, your digital hand? Okay. Yeah, you're on the panel. You're on the panel. Ladies and gentlemen, please join me in welcoming the Provost of the College of Health Sciences for his vote of thanks. Over to you, sir.
Thank you so much, Miles, the convener, the coordinator of the Global Health Nigeria, and all our international partners. I'm delighted to be with us this afternoon as we witness this making event, the launch of the Nigeria chapter. It's just there for me to express appreciation on behalf of the entire university and indeed the College of Health Sciences. We are delighted to host this very, very important group, and I will pledge our support in whatever we can, whatever we need to do to drive this agenda and move it forward. I can assure you that the college and indeed the university will do that. Once more, congratulations to the team, congratulations to us, congratulations to everyone. Thank you so much, and best wishes.
Thank you very much. That is the Provost of the College of Health Sciences, Obafemi Awolowo University. Thank you so very much, sir, for joining us. All right. I think that is the much that we have from the goodwill message session. I'm going to jump in real quick to a very important area that I just can't afford not to look at today before we step aside or before we call it a day. Louis, if you give me the permission to share my screen. I believe we all can see my screen from your end. This is the Global Health Network Nigeria Country Center landing page. The URL will be made available on the chat for you. You can access it anytime. All of the resources that Professor Trudy Lang and Christine and Dr. Ola talked about, you find all of them there. A part of the activities that the center has hosted in time past, can find the detailed report and the video recording of this event available here for you. And you can click on any of these green buttons to display wonderful content that are embedded underneath. And below here is the calendar of the Global Health Network. And as you can see here, you have the a notice of this event that is holding here today. So we have a lot of things available for your consumption on the Global Health Network Nigeria Country Center. You are free to look at it at any time and to take advantage of the wonderful opportunities that is available there. So, ladies and gentlemen, we are almost coming to the end of our program. So, Louis, can you just show the last slide? Show the last slide so that we can officially cut the ribbon and declare the Global Health Network Nigeria Country Center officially launched, officially open. So, ladies and gentlemen, from the very depth of our heart, we want to say a big thank you to everybody, to Professor Trudy Lang, to the Global Health Network, to the Obafemi Awolowo University, to all of the amazing individuals who volunteer to serve as the mentors of this great network. We are very, 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 very happy, and we appreciate you for your time and for the effort and energy that you have exerted towards making the launch event of the Nigeria Country Center of the Global Health Network a success. So from all of us, those behind the scene and those that you can see on your screen, we are very, very happy. We wish you good luck and happiness, and we look forward to catching up with you next time. Use the resources that we have shared with you. More opportunities will be made available on that platform for you to take advantage of. Once again, my name is Ohemo Godwin Pius, and it has been an amazing opportunity to chair the official launch event of the Global Health Network Nigeria Country Center. Thank you so very much from all of us, and the Global Health Network Nigeria Country Center is now launched, and we have to swing into action, get busy, making available the plan that Dr. Ola shared in the course of his presentation. Thank you so very much, everyone, and do have a wonderful day. Bye for now.